And welcome again, everyone. It's Monday night, 7 p.m., which means it's time for the Fab Four, except there's only a Fab Three and me. And let's go ahead and get this out of the way because we sort of had a bet, but we didn't last week. And Dr. Chan's home, as you know, is a Saints fan. As you know, I'm a Packer owner. I don't have quite as many shares as Jerry does in his team. So let's get it over.
Oh, not too bad. Mary Davis, live and in color. Aaron Rodgers' face.
Oh, man. That's what we were waiting for? That's okay, for heaven's sakes. So the Saints have a third-team quarterback, half their team are out, and they embarrassed us last night. So it's unbelievable. So
but you can be happy there's an extra game this year.
Oh boy.
I mean, apparently Tulane and the Saints are they want to play every game in a neutral stadium on the road or whatever, right? I mean, Tulane comes out of Hurricane Ida, damn near whoops Oklahoma on Owen Field, and then Saints go to Jacksonville and almost beat Green Bay, or beat the heck out of Green Bay. Not almost, beat the heck out of it.
It's more money ball because the Saints said Aaron Rodgers, I looked up the numbers. He plays terrible in Jacksonville. So they decided to play in Jacksonville. And guess what? Okay, money ball. It happened.
They said they wanted to play in the heat. That's why they chose Jacksonville.
Yeah. Well,
you don't have to worry. They're going to trade Rodgers away, so it's his last season.
All right, well, welcome, everybody. I'm so
Maybe Tampa Bay will take him.
Seems to be their MO.
Yeah, well, they did what they need to do, which is on behalf of Packer fans everywhere. Hey, we have a great program for you tonight, and so we have. We're getting some feedback here. We know who it was now. As I muted Dr. Armitage. So, anyway, the thing is we have a great show for you. We're going to start off with a lot of breaking news, and then at the bottom of the hour, Oklahoma County got to this 75%. At least one person, or at least everybody, 75% of the people in Oklahoma County, at least one shot so far. It's the magic number. And they're going to be joining us at the bottom. I think Phil Maytubby, who's the chief operation officer, is going to be joining us. And then at 7:45, somebody you're going to meet and you're going to love. And that's Laryssa Lalli. She is doing the doctors have been saying we got to be talking about nutrition. She does nutrition specifically for young people, specifically for people to improve their mental health. And Dr. Bookman and she and I were talking a little bit earlier, and Dr. Bookman was talking about the hurdles that we have in good old barbecue / Oklahoma, and we'll be talking to her about 7:45. So that's coming up. But glad you're with us. Dr. Bookman, take it away. I know you've got something on your heart and mind tonight.
Well, I do, and thanks, Scott. We, on this program, have always tried to talk about science, truth, and recently, this past week, a friend sent an article to me that was authored by the director of the Center for Independent Journalism for the Oklahoma Council for Public Affairs. And the title of the article was Medical Associations Wade into Politics. Now, I've been with the OSMA, and I will forthrightly state that I'm a past president of the State Medical Association as well as the county. So we've been involved in politics for more than 20 years. But specifically, I want to talk about 3 points that were made in this article that are just outright false. They start off by saying OSMA opposed legislation to prevent abortions. No one from the OSMA leadership was ever contacted to find out why we took that position. It was opposed because the bills criminalized doctors for performing a legal procedure. House Bill 1102 makes performing an abortion that is not deemed medically necessary, doesn't say by who, not deemed medically necessary to preserve the life of the mother, grounds for a physician to lose their license. Number one. Number two, House Bill 2441, both of which have been signed by the governor, prevents an abortion after a fetal heartbeat can be determined, much like the Texas bill. It makes no provisions for rape, incest, and does not take into consideration the mother's mental or physical health, both of which were poorly written bills And all we asked was to discuss this with the medical community so that we got a good law. That was never done. Even worse, the author stated that OSMA opposed legislation protecting consumers from surprise billing, from bills on people who may not be on their insurance that they didn't know about. This is an outright lie. House Bill 1006 by Representative Carol Bush was initiated by the doctor members of the OSMA, and I was there at Governor Stitt's side when the bill was signed. And I have a picture hanging on my wall at this moment showing the bill being signed by Governor Stitt. It created the Transparency in Healthcare Prices Act. That's the first legislation to try to get transparency for the doctors and the hospitals, and it was initiated by OSMA, not opposed. OSMA and doctors throughout the United States have overwhelmingly supported the use of masks in schools to protect our youngest unprotected citizens. This was not to restrict parents' rights, as the author put, but to save as many children from getting sick as possible. This is what physicians do. They try to protect and promote health of all patients. And we've now seen over 1 million new cases in children in the last 1 month. Maybe masks would help. And while OSMA's membership may be less than 50% of the state's physicians, which the author made a big point of, its legislative role has been to protect rural hospitals and access to care throughout the state for the last 10 years that I've been in leadership. It has never been to preserve the income of physicians, which is what was stated in the article. Independent journalism is important, and I believe in the freedoms of speech and the press, but there's also an obligation to report accurately and without prejudice. This was not done in this report, and for that reason, I felt it was important to report the truth and accurate information. And I'll open it up to the other panelists. I don't know if you've read the article in OCPA, but I think that it's part of the fake news that we heard so much about with the last president.
Well, I'll jump in real quick and just say I think it is important to set the record straight, particularly your third point where there can be no debate around the facts of the case. If the OSMA helped craft a bill, help the author write the bill, and you have a picture as part of that ceremony of success. I mean, again, a good journalist, that's a retraction. That's what happens when they're caught out. I'm not sure that happens much anymore, but as far as I know, that's what's supposed to happen. And the other positions, again, willful omission of the entire story is almost as good as you put it, a blatant lie with the third instance. You've got to, these complex issues demand complex reporting. It requires the exceptions be indicated. Otherwise, everything becomes a cartoon. All the thinking becomes so abstracted from its basis that it's nearly meaningless. So I think physicians have long stood for protecting the health of the mom and having that as an absolute frame of reference in the situation of abortions and other instances too. Incest and other things come into this, but clearly asking for a more sophisticated reporting. There's so few journalists. It's a shrinking breed. That I think they could do well to hold on to their professionalism so that they differentiate from all the people with smartphones who are now journalists. So that's my take on it.
I haven't read the article. I think that just reading the first few paragraphs of the article, it's written more like it's the last thing I would call it is independent journalism. It's written more like an opinion piece, really. I mean, it's on its the leading voice. It says the OSMA says its vision is to be the leading voice in healthcare for America's patients, families, and physicians. We are, and that's what we continue to be, and that's what we've been certainly for the last year and a half. Even before that, I think Larry made the excellent point. We have all been about trying to save critical access hospitals, trying to save rural America from everything that's coming through. We are the leading resource for healthcare expertise, maybe not policy, but expertise. But this, I'm not sure it's valued. As you know, 2 of our members were let go from the OHCA not too long ago. So, you know, I mean, you can ignore reality if you want to on all these points, but you pay a terrible price for that. And I mean, most physicians I know are about science and about taking care of patients. That's it. And you know, it's not about us making money. We're going to be fine. Every physician I know is fine. What we do is we take care of patients, and that's it. And whatever we can do to improve access to care and improve quality of care, I think that's what we're going to do, right? I mean, I don't know. I have to read the whole article, but just right off the bat, it starts out with critical race theory right off the bat. Well, what does that have to do with any of this stuff?
I just felt it was important to respond. I hope OSMA and others will respond as well. But I do think that independent journalism is important, but I think they need to do a quality job, not a hack job like this. So that was my point.
Well, and I would just throw in one other thing. Anybody who thinks that physicians through a professional association shouldn't be political, that surprises me, because so much of medicine hinges upon federal policies up and down the board, whether it's safety regulations in the hospital, whether it's Medicare eligibility rules. There are just so many ways that there's a interface between medicine and being able to advocate in that very important dimension for the patient. So it would be sort of like association malpractice, not to try to articulate to political leaders and assist political leaders in informing good policy. You know, the realtors are out there advocating for realtors, and the oil men are advocating for oil men. And, you know, professions owe it to their members to try to be as effective and hopefully fair and humane in our case, I know, for physicians. So, you know, please don't throw a stone on that grounds, because our house is made of brick there. There's no glass house there.
And as we end this little part, because we have a guest to come on, but I just want to say I was taught by one of my mentors, who I have the utmost respect for, that if you're not at the table of discussion for the political side, you're on the menu. So, you know, take that as the truth. And that's, yes, we are under political influence, but so is every other organization. So, so I want to move on. We're fortunate to have Phil Maytubby, and I'm going to let Scott introduce him. Well, Scott's mic's not working. You're muted, Scott.
Not anymore.
There you go.
That's the way the doctors prefer me to be. So Phil's outside. Phil Maytubby's the chief operations officer. When I saw last week it was a city council dishing out science and being booed. So I'm thinking, okay, situation normal. I mean, what did they want you to say at city council last week, Phil? Or fairy dust or
anything but what I said, Scott. So,
but by the way, I'd like to point out that science these days is shoveled and not dished.
Yeah, that was a tough one, guys. It's hard to fight the disease and all the other things that are going on right now, especially with everybody being so biased in one direction or another. we've never really had to deal with this situation before like this. Not ever. H1N1, Ebola, any of these other things. We've never had, people always took the advice of science, and this time it's different. So it's a much harder reach to try to get to people.
Phil, we've talked about it on this show a lot, that I've never seen a disease and a quality treatment so politicized as we have under this pandemic. I'm old enough to remember the polio vaccine when it first came out, and my parents took me, and without question, we all went and got the polio vaccine. And I had people arguing with me today or this weekend saying that wasn't a vaccine, that was immunization, not vaccine. That's different than what we have now. I'm like, what?
Totally different. Totally different.
Totally different.
Semantics.
I have never seen people argue about something that could save their life. And, we see every day death after death, families saying, I wish I had gotten vaccinated. I'm sure David sees it in the hospital. It's incredible to me. I don't understand.
Yeah, I don't either. So I've never also seen so many people take one nugget, especially out of some outdated science that happened early on during COVID, and now try to utilize it as a relevant point. So there's a lot of that going on, and it makes it very difficult. Sometimes they're telling a partial truth. So, I mean, part of it, like one part out of 5 might actually be a relevant statement that's coming out, but the rest of it's all, it's not real and it's being taken out of context. So it makes it very difficult to manage the conversations with these folks. And remember too, when you're dealing with these folks that were like I had to endure at city council, their whole game plan is to get you off base. It's to get you off track.
Right.
It's to deceive. It's to confuse. It's for you to get off, and for them, that's a win for them. So, anytime we can just keep our composure and do what we need to do, and because I'll be honest, that backfired on them after that. So, I mean, all the public comments were like, where did these people come from? I mean, they're definitely not, they're science deniers. So I don't know where else you go with that. I mean, all we can do is keep putting out there what's relevant and what's real. I mean, real science, data driven, and we can't let them win by just shutting up. So that's what we're going to do at the health.
Absolutely right, Phil. I mean, it's so difficult. I mean, as physicians, we trained for years. I can remember when I was in residency, every other week we had a conference dedicated just to learning how to read the science. It's hard to read science. It's hard to read those papers. I did that for 3 years, and we did the McMaster's course. And as physicians, that's part of our training, learning to read the science. I think, like you made a great point, people will take one little nugget and they'll make all of these conclusions that just don't make any sense scientifically. I think the fertility one is a perfect example of that, where they take one little nugget of a mildly similar DNA codon and all of a sudden extrapolate it to this, that, and the other. What I think is so fascinating is the same people, you remember the beginning of this thing, right, guys, where we were accused of fear-mongering in the hospitals by a state leader of fear-mongering in the hospitals, and saying that it was, a much worse disease than it really is and everything like that. Yet these same people are unafraid to fearmonger over totally unfounded stuff about the vaccine, to fearmonger over totally unfounded stuff about remdesivir, and kind of fearmonger in the opposite direction about ivermectin and hydroxychloroquine and this whole huge conspiracy theory. I don't know when everything became so conspiratorial. And it becomes very, very difficult. And I can tell you, just this weekend alone, I had 3 people in the hospital asking me to vaccinate them. I was like, it doesn't work now. You got to do it before. It's very, very, it's really sad to watch. I mean, it's not easy, believe me.
It is. Did you guys see the CDC numbers that were out today
For
for the vaccinated versus the unvaccinated? I didn't know if you already talked about it.
about the 11 times
No.
higher risk of hospitalization.
5 times more
Yeah.
likely to be infected if you're unvaccinated, 10 times likely to be hospitalized, and 10 times more likely to die.
Yeah.
I don't know what else. I mean, you can do to try to convince people. I think we've done our a good job of trying to get the science out there. Just we're getting drowned out by all the misinformation. And
It's also important, I think, and David can support this, that every state is reported the same thing. Greater than 90% of their hospital ICU patients are unvaccinated. That's not by accident when it's state after state after state. And yet they ignore those numbers.
those don't match.
Yeah.
With them.
John, I see you
have you
wanting to
seen
say something.
in some of the worst vaccinated places? I was reading quite a bit today. It's morbidly curious about the things going on in northern Idaho, where they're actually starting to mobilize their scarce resource allocation teams and having to make really hard choices that no doctor would ever want to have to make. But that is happening in some places that have these holes of very little vaccination and less access to care because it's a very rural area. It's awful, awful, awful.
Well, I will give you an example, and John, I'm going to let you talk. Today, I was in I'll call it a rural hospital. They had an acute upper GI bleed, which is what I take care of as a gastroenterologist, come in. It came in yesterday on Sunday when there was no one there. They called every hospital with GI coverage in Oklahoma and North Texas and could not find one hospital to accept the patient because they had no ICU beds.
Mm-hmm.
So that patient had to wait till I got down there this morning to take care of him. Now, he survived, but the point is there's not one bed in North Texas or Oklahoma that would accept him. So that's what COVID's done to our hospitals. John, I know you've been bursting to talk.
As always, I think personalizing it, your narrative there about the price we're all paying in terms of deflected care or delayed care. Those stories, the personalization of the narratives. Today, I learned that one of our employees lost a middle-aged child to COVID. Makes it a little bit more personal when you're close to it. I think part of our challenge is with respect to confidentiality and patient privacy. We need to share the stories. We need to tell and show pictures of the folks we've lost and make it more personal and more resonant. I mean, dealing in abstract numbers and letting people argue with you about, drugs that nobody can pronounce or knew about, 6 months ago, that's not a winning way to win hearts and minds. It's almost like debate club where, people go back and forth, but, it's all a hollow activity when it comes to behavioral change. So I would argue that we need better ways to pipe in the meaningful narratives such as appear often on this show, but let's systematize that. Let's create tools to ask families to share those stories and to allow them to be cautionary tales, that sort of thing. And the other point I'd like to bring out that really surprised me, because we got some blowback from some of our employees at the Blood Institute about our voluntary program, our bonus program for staff who get inoculated, vaccinated, immunized, whatever you want to call it. Lots of synonyms out there, folks. But at any rate, the blowback came from somebody. I think she's a high school graduate, and it occurred to me that and I told her that this was the third time she'd brought up some difficulties with our policy, and I basically put back that I'd spent 8 years in medical school and 25 years in the healthcare profession, and I've kind of taken the inputs and this is what I can see best. And it reminded me, I wouldn't go and tell Elon Musk's team how to design their rocket. And a rocket is a lot less complicated at the end of the day than the human body, right? So I don't picture myself as a rocket scientist. I'm not going to go in there and say, well, I think you should use a different bolt here. So the idea that people can wander into a field of such specialization and have, these strong opinions. I guess I could have a strong opinion about the design of the recliner the astronauts use, but I don't think it would be informed by much. And again, that's kind of, we've unleashed this concept that everybody can be an expert, everybody's entitled to an opinion. Well, not an informed opinion. You're entitled to a random opinion. But unless you study and unless you really have a depth that goes beyond what you read this past week, you're probably out of your depth. So if you can believe what you want, but you probably don't want to post a lot about it. You probably don't want to sit on a soapbox. If your background, if you've become a biologist only about COVID in the last 18 months, then you're probably not a very good biologist. And you probably don't want to say a whole lot. You can form your own opinions, get expertise, but don't be an expert. Or alternatively, go take some college level courses, grad school courses, learn some immunology, and then, start to position yourself where you can have your soapbox.
I'll take it a step further than that, John. I think it's about expertise in the field. I've been a doctor since 1993. So what's that? About 30. It's coming up on 30 years. Awful. I do not understand the oil and gas business, and I never will, because I haven't done it for 30 years. You know what I'm saying? I don't understand the difference between fracking and drill. I mean, I do a little bit, but just what I read on the internet. But no one's asking me to drill a well either. So, I don't. I can fix my Jeeps right up until the point where I have to take it to an expert at the mechanics place. We all have our roles in society. And as the physicians in the past, we have been, and the physicians and the scientists, we have been tasked with finding out what's best for communities, health-wise and technology-wise, and providing that to them. And that was enough in the past. I'm sorry, I cannot explain cell-mediated immunity to everybody. It is complicated. It is really, really hard to understand CMI. And it's, but at some point in time, you have to trust the oil and gas guy that they're getting the gas to your car in the best way that they know how to do it, and it's going through the right refinery and all that kind of stuff. And that's what we're asking people to do. But for some reason, people want to say that we're misinforming, like we have some sort of secondary agenda. I just have never understood it. I don't think I ever will.
Well, hey guys, I'll add a corollary to my set of rules of not taking the microphone if you really aren't positioned to and don't have the background. If you weren't a biologist before COVID, you're probably not one now.
Right.
And if you're not an expert in several other biological areas, you're probably not an expert in COVID either. If you're an expert in heart surgery and a ton about ecobiology, okay, maybe you've got the right to the microphone in some shape. But if you have absolutely no other biological expertise except COVID in your own mind, you probably want to check it.
Hey, did you guys talk about variants today?
No, we haven't.
I've talked about it plenty, but not on this show. Yeah.
Well, we're significantly Delta now, over 80% Delta in this state, and nationally too. So you know what that means? Delta, I mean, it's just so much more infectious. We've heard a lot of talk about Mu and Lambda and Gamma, and those just aren't going to get a foothold while Delta's here. So, they're not of significant concern to us right now, just because they're not even going to get an option to expand. Not until Delta wanes. So we'll see what happens with that. So I don't know if you talked about breakthrough cases, but for nationally, the percentage of breakthrough cases is 0.008%. That's less than 1%. So when people tell you, how do you know the vaccine works? People are still getting it that are vaccinated. Well, that's a pretty small percentage. And then when you look at the asymptomatic cases, which is up to about 21%, what that tells you is the vaccine is working. It was designed to keep you out of the hospital.
That's right.
And that's what it does. So
Yeah, I think some people have misunderstood that the vaccine is meant to cure them, or as David brought up, getting it while they're in the hospital, or that it absolutely 100% is going to prevent them from getting the virus. And neither one of those are accurate statements.
nothing's 100%. That's just not going to occur. There are always subtle differences in people's biology that will make them susceptible. So, and that's why we always try to refer everybody back to your physician. Your physician at your private physician or your personal care physician is going to know exactly what issues you have going on, and they're going to give you the best medical advice. So, by the way, Dr. Chanso, and I didn't know if you were on the chamber presentation on last week, but we were trying to highlight the situation with the hospitals, even trying to get it where people really explain it, because I think it gets muddled. People look at bed counts. Bed counts are irrelevant now. It needs to be staffing counts. So, I mean, we can have all the beds we want, but we don't have enough people to operate them. So essentially we're at capacity now. There really is no more room.
We need nurses. We need nurses. We need respiratory therapists. We need housekeepers. We need. Yeah, we've said it a gazillion times on this show, Phil. A bed does no good without a nurse standing next to it. So, and again, what people have to understand also is the work intensity for a COVID patient is significantly more. You got to don, you got to doff, you got to put the thing on, you got to have your PAPR on, you got to put the battery on, you got to do this, you got to do that. We did some doctor diaries. You can see the ICU beds have the poles outside of the room, so the nurse doesn't have to go inside every time. They have 20 different medications hanging from them. I mean, not only do you have to have a nurse, but a nurse tech, a respiratory therapist, physical therapist. I mean, it's a lot of people. So that's the discrepancy in the beds, I think, has come kind of from the licensed bed availability versus the staff beds. I can tell you, representing the biggest hospital system in the state, we have been 100% honest. If there was ever any discrepancy, it was totally unintentional. I can promise you there are no beds available, as Larry's story would indicate. We're not into turning away people for care. We want to care for everybody that we can. But right now, it's just there is no staffed bed available.
So can I ask a question? When we have a tornado that's, even the threat of a tornado with a hook, a hook form on a cloud radar scope, we get a lot of alerts about that. And we, rightfully we pay a lot of attention. Shouldn't there be like some little ticker going underneath the screen on the nightly local news saying what our count of available ICU beds is? Seems like we're in a pretty desperate situation for what most of us would take as a really important emergency level of care. The story you told, Larry, about somebody sitting in the wrong part of the hospital overnight, just everybody just hoping that worked out. I guess it did, fortunately. But, to me, that not having ICU beds, if I have my MI, that's really important to know where we stand. And I guess maybe we need somebody as photogenic as, our meteorologist. Maybe we need a healthcare, update. We can create some good graphics and, probably not call out any individual hospitals, but it just seems like as a level of public safety, no ICUs should be on everybody's radar until we get that fixed. But
I agree.
Part of it is it's kind of fluid. It's IC beds in the morning versus IC beds. But I know you know all that stuff. But I think that the hospitals, the metro hospitals, have gotten together. The four major systems have gotten together to present their own bed count so that people feel like, because before it had to go through a couple of different channels and everything. And yeah, you're right. I think now one of the channels I think is occasionally doing that. I saw yesterday that there was one ICU bed at Integris. I just kind of laughed. I giggled. I mean, it's just so fluid all the time. It's kind of a graphic, but we are practicing ICU level care in the emergency room pretty frequently. We are practicing ICU level care in step down units. So a lot of it, just again, like Phil said, comes back to expertise and who's staffing the bed.
Yeah, and I do think some of the channels have tried to give that number, but what they always forget is how many are in the emergency room waiting for that bed that's available. And you're right, we practice ICU medicine in the emergency room.
Well, I think it's up to us to come up with a way to help the media articulate that average wait time to find a bed for those who are in temporary arrangements in step down units, those sort of things. Maybe that's where we can contribute some insight as to, what would make you feel good at the end of the day, David, is probably no waits, right? You can find a bed, without, a certain number of patients per week having to wait. But again, maybe that's some place where, the Homeland Security came up with the always orange system of warning. We don't want to get into that trap, but something that's a little bit more dynamic and maybe helps people understand the risk that everybody's taking. And just accepting. I know I would be out of my mind if I thought my loved one, they had a trauma or they needed the ICU care and they were parked somewhere waiting for a bed. Talk about a bad situation gone worse in terms of anxiety. At any rate, maybe not today, but eventually we can figure it out.
Well, and Phil, I know we could go on and on talking with you, and we'll have you on again. Unfortunately, we have another guest, and I'm going to let Scott talk about that guest. But Phil, thank you.
Thank you.
And thank you for everything that the City County Health Department does. We respect you. We appreciate you. And we will certainly have you on again. So keep your chin up.
I always like being on with the docs. So
Hey, real quick, Phil, question before you leave. So you guys got to 75%. What's the magic ingredient in getting Oklahoma County to at least 75%? Describe what 75% is.
well, let me tell you what it took to get there. It's all of these partnerships that we've developed over 20 years of working with medical professionals in our community. That's what got us there. And then, we are putting out as much information as we can. So I will tell you, though, our staff are fantastic. Mm-hmm. They are tired, but they are persevering, and they're going to continue to do what they're doing. So we've got some really good people I'd like to introduce you to at some point, like the people that plan and do those things. So you guys know the magic number for us that we're trying to hit is 80% with 2 doses.
Let's get there. Let's do it.
That's where we're trying to get.
I will call out specifically, Phil. We have communicated primarily with Kara Gluck and Elizabeth Billingsley, and they are outstanding, responsive, and have kept us stocked with vaccine. And the OCCHD, I think, has just done a wonderful, wonderful job of making sure. I know personally of several doctors who are not infectious diseases who have been able to get vaccines in their clinic because I shamed them, frankly. But OCCHD has been great with them also, and I appreciate very, very much everything y'all are doing there. I think you're doing just a fantastic job.
Well, thanks to you guys, we have 265 people now distributing vaccine in Oklahoma County.
That's awesome.
That's the difference.
That's it.
I watched
You're doing a great job.
I watched some of the folks that were after Phil the other day. Dr. Gaddy, Oklahoma's most well-known political science professor, and I've decided that before they get into deciding what's good or bad on medicine, they need to learn the difference between a commie and a Nazi. So, it's very interchangeable. Have you noticed that? So from my history, the commies and the Nazis ain't the same thing or interchangeable. And so Keith says, I think I probably do need to do a primer before you get into talking about hydroxychloroquine. You should probably figure out the difference between a commie and a Nazi, because when you watch some of this stuff, like they'll call somebody a commie, and then 5 minutes later it's a Nazi, and I'm like, dude, make up your mind. They're not the same sort of thing. So if you can't,
you need expertise to do history as well,
right? That also requires a long degree, and yeah.
Well, hey, I
Well-
appreciate you guys thanking our staff, because our staff are who do it. So
No doubt.
We'll do a salute show. Okay. I mean, I think that people need to meet these. Hey, no matter the politicians take credit, then the politicians get mad and all this sort of stuff. But the people at OCCHD and state and Tulsa, the public health professionals have just been, they have bowed their back and they have gone right ahead and they have just decided we're going to get this done. And it's been an incredible thing to see. How quickly do you think you could get to 80, Phil?
I don't know. I mean, we're still down to that population that's fairly hard to get to. I mean, people are changing their minds. I mean, you know what's changing their minds is they're seeing their family members or friends in the hospital, or somebody died that they know. Now, you don't hear that anymore. Hey, do you know anyone that's actually had it? Hey, do you know anyone that's actually died from it?
Yeah.
Now, everybody has that. So a lot of that argument's gone away. So
I maintain that getting to 265 members is absolutely fantastic, because I know so many physicians who just got that vaccine in and recognize that physician-patient interface is the most opportune time to be able to get a needle in an arm. Asking them to go to the pharmacy to get it or something like that just doesn't happen. So continuing to find, we're not going to catch 5% all at once, but we'll catch 5%, 0.1% at a time, which by trying to find these tiny little niches here and there.
But I hate to jump in with a big topic, but we haven't really discussed President Biden's plan for large employers or the CMS driven mandates back into the healthcare system. But I'm assuming you support those as at least efforts to try and break the logjam, Phil, or?
Well, we always support mitigation and vaccination, but the way in which it's put out is just as important as how you do it. Because I thought we were making some real headway with the population. And, as long as it's voluntary, people come around. When you make it mandatory, they fight us. So we have to see how the best way is to get there.
Unless it gets into
I
pocket.
do think
We'll see how that works.
Yeah, I do think that the anti-vaxxers are going to get more galvanized against mandates in the private industry, not the federal. I think the federal is a different story. But, even the hospitals, as David has pointed out, we don't have enough nurses. You can't let nurses go who don't get vaccinated, yet they need to be vaccinated. So it's more a matter of convincing them and, talking to them than it is by mandating it. So that's going to be a difficult story, and we'll see what happens in the near future. So, well, Scott, we've got another guest.
Thanks very much, and we'll be talking to you soon. All right.
Talk to you guys later.
Thank you.
So one of the requirements of staying producer of this show is keep the doctors happy, and this lady right here is to take care of that. Other things are going on in life besides COVID, which we were talking about for many months. Welcome to the program, Laryssa Lalli. Now, this is one of the nicest people in the entire world, and she's working now a new business to really address nutrition in this state. And the doctors all know, and everybody who's watching knows, we really do a really bad job. Laryssa, it's exciting. We saw your place today. Tell us about the program and what you're doing. These guys are going to eat this up.
Thank you. Thanks so much for having me. So yes, I recently became the owner of a meal prep kitchen called Real Meals Kitchen. And our main goal there is to provide whole food, plant-based, healthy food on the go. It's really easy to stop at our corner and pick up a quick meal. Mm-hmm. That's not going to be the healthiest option for us. So we want to make that accessible and easy for people to get something they know. They can pronounce the ingredients. They know it's going to be something that will actually nourish their body. So that's what we're doing.
Is that a reference to quinoa? Being able to pronounce it?
Quinoa, yes. Quinoa is really actually quite good.
But it's hard to pronounce.
It is kind of hard to pronounce. You're right. You got me on that one.
And Laryssa, we've got photographs of some of the things you prepared. You just let me know which ones you want to put up there, and we'll show our audience. Can I just start with this one right here?
You can, yes, you can start with any of them. So when I talk about whole food, we really utilize whole food. I try very much to use as much fresh produce as I possibly can. Any of the ingredients are going to be as less processed as we possibly can. There's a few things I've got to rely on somebody else to do that for me, but I'd say that we're probably 97, 98% unprocessed and actual whole food. So the brighter the vegetables, the more goods for your body, the more good nutrients for your body. And so this is a stir fry. This is utilizing chickpeas. They're high in protein, fiber. And then this is a really interesting take on tabbouleh. It's actually done with cauliflower rice or riced cauliflower, but the same herbs and seasonings that go in tabbouleh. It's fantastic. Some people like tomatoes. Others, like me, are not that crazy about them. So there's one without tomatoes.
Where's the hummus?
Where's the hummus? It's actually in the kitchen, in the refrigerator at the kitchen in our grab and go.
Okay.
We do house-made hummus too, and it's quite delicious. We actually have a chocolate hummus for fruits.
Oh, wow, really?
Pretty good too. So these are some smoothies. Again, whole foods in these. I'm not going to use any artificial sweeteners or even added sugars in these. Blueberries, raspberries, strawberries, fresh greens going in some of them, not all of them. And then also peanut butter. You like peanut butter, like Reese's, but healthy. Peanut butter and banana smoothies are also good.
I love those.
Yeah. Okay, so there's the hummus. So in those little cups, that's our house-made hummus. It's got some garlic in it, which my husband's Italian, so we do a lot of garlic in our house. So I translate that to the kitchen. And then vegetables, and then also a granola bar that's protein, peanut-based. So it's a good little bit of protein with gluten-free oats, dairy-free chocolate chips. That's another thing I try to stay away from. Some of the allergens, of course, peanuts are an allergen, but we're going to do that dairy-free along with it, and then we watch our gluten content as well.
So how do you get people to uptake it, Laryssa? You and Dr. Bookman had an interesting discussion a while ago because people love Big Macs.
Yeah, they do, and ribs and mashed potatoes and gravy and,
yeah,
and all the good
chicken fried steak. Yeah,
chicken fried steak, absolutely. I think it's a process, and I think you have to get to a point in your life where you realize you need to make some changes. Other than that, it's going to be really difficult, especially where we are. I mean, we definitely are in fried foods. Dr. Bookman, you talked about recommending fish. Well, fried catfish is not the kind of fish that we're talking about. We're talking about salmon. Baked salmon is fantastic. We actually had some on the menu today with asparagus. So you're getting some good omega-3s, but then the vitamins from the asparagus too. So I think it's a process that people have to go through.
And how do they find out about you?
We're on social media platforms, website, Instagram, Facebook. We're on all those. So they can find us. They can give us a call too. 405-906-7400 is our number. So we're there.
Are you aware of, it seems like the convenience thing that is awesome. That's one of the barriers I think a lot of people perceive with healthy nutrition. Sounds like you're doing a lot to work on that. Are you aware of any ways that I'm thinking of OBI, for example? Our food sources are our vending machines and the food trucks that show up.
Yeah.
And they're great. They're all those ribs and things you were talking about.
Right.
But, are you aware of a kind of like a way an employer might try to start pushing a little bit more healthy options, knowing it's a convenience thing as well?
Probably one of the easiest way for an employer to do that is actually have the food brought in, because that's number one, it's convenient. And I think that's what a lot of people want. Cooking healthy is, I don't want to say it's hard. It's really not hard, but it takes time. It takes a little knowledge and know-how. And some people just don't want to take that time. So to have that food actually brought in is a great way to do that. Meal planning. Having the employers learn how to meal plan. What are some of the basic steps where it can be easy for them to do it at home and then translate it into the workplace also helps.
So, would we be able to do a lunch and learn at OBI where you'd bring some food
Absolutely.
and then tell our folks how to make it if they liked it?
Absolutely. Absolutely. I think Scott mentioned I'm a former kindergarten teacher, so teaching is in my heart. It's just part of what I love to do and love to share. So absolutely, because here's one of the things I found is that when we as adults work on what we're eating and how we improve our nutrition, that translates down to our children. And they learn by example. They learn by watching us. So if we're scarfing down, the big box of tacos that came from, I don't know where and what's in it, that's what they're going to emulate. But if they see us eating a plate full of vegetables or lean meats, things like that, then they're going to emulate that. And especially if we bring them into the mix and teach them how to do it, that ups their chances. And so really, I think it starts with adults. It doesn't start with kids. It starts with the adults.
Laryssa,
We've talked about this. Well, I was going to say, we've talked about this, especially being healthy in schools, getting our schools to, get away from the fast foods that are so prevalent and eating healthy. And what you're talking about really is about health, not about just weight loss. This is not a fad diet to lose weight. It's a way to start feeling better by eating healthy and, doing the right thing.
Absolutely. I think weight loss is a byproduct of getting healthy, so to speak. It's all encompassing, but once we can get our health in line, and that's our focus, if that's our primary focus, I think other things start to fall in line. I think some of the different diseases can be managed a little bit better. I think mental health comes in play. I think that can be managed a little bit better, but we've got to start with making some good choices with foods that we know are actually doing our body good and not harming them. And you mentioned the schools. That's a whole nother, we could talk for an hour on that one. I think our schools need to be bringing in some better food for these kids. Can't expect them to do well when they're hyped up on all the things that I know they eat.
And we've talked about it on this show.
Hey, listen, thanks for being with us. Is Dino Lalli there? Is he lurking in the background somewhere?
He's actually not. No, he's not.
Good for you. Good for you.
Yeah.
All right. We'll want to see you again, and we want to talk more about
you.
this topic. And congratulations on the new company, and best of luck to you.
Thanks, you. I appreciate it.
Good luck.
All right.
Awesome work.
Thank you.
Good luck.
Thanks very much.
Thank you.
All right. I promised Dr. Chen a hard stop at 8 o'clock. We got 2 minutes left. Final comments, gentlemen?
Well, I have a question for Dr. Chansom. So this is going to be how we end. I was sent a question today that I could not answer, and I don't know if there is an answer, but I was asked, what percentage of ICU patients have had prior COVID-19?
That are in the hospital with COVID?
Right, in the ICU.
Very few. A few, not very many. Not very many. I would say a percentage. I mean, I can't tell you specifically. It's not something we track. So what we track, because we can do it pretty easily off our computer system, I can only speak for Integris, but I can tell you that it's easy for us to track vaccination status because, those are already in the medical record. And then you can compare that to where they are with COVID. So we can track that pretty easily. It's a little bit more difficult to track previous COVID, but I can tell you just my interaction with patients and everything like that, it's not very common.
The reason that I think was brought up is that there is still an argument by many people that if they've had prior COVID, they don't need to get vaccinated. And I say that's wrong. And I think the studies have said that's wrong, that they do need to get vaccinated. So
they do. They're still much less likely to, end up with severe disease. Clearly a person that's been fully vaccinated and has had COVID, I don't want to say bulletproof, but is as well protected as you can be because you have antibodies against multiple different targets, not just the spike protein. But there are so many reasons to get vaccinated that to say just because you've had COVID is not a good reason is not it's not supported right now. That certainly is true. Now, more and more data is coming out. We got to remember, this is still only a disease that is a year and a half old in this state. Think about it. It's only a year and a half old. What other diseases are we expected to have compendiums of information on after a year and a half? It takes time to get that data together. It takes time to assess, and it has to be parsed through scientifically, rigorously, honestly, and with an objective lens before we can sit here and say, this, that, or the other is true. And so it continues to be difficult to do that in a really, really fast fashion. Everybody wants answers yesterday. I don't know what native immunity will mean in the future. If all of a sudden, that mu variant becomes something real, it probably won't mean squat. I mean, I don't know. We'll just have to wait and see.
It's 8 o'clock.
Okay. I'd like to end on my last question, which was coming on our comments a while ago. Dr. Chen, some buddy of mine asked if any of you had ever seen a commie drink a glass of water, and then wanted to know about fluoridation, the most monstrous conspiracy in the humankind. Fluoridation. Okay, so that's a Kubrick reference. It's just way over everybody's head tonight. So,
Tommy drank a glass of water. Was that from Clockwork?
No, that's the next
Strange
one.
Love.
Strange Love.
Oh, Strange Love. Okay.
So I've never seen drink a glass of water. So, all right, Dr. Armitage.
Yeah, I wanted to ask Laryssa whether or not they had sour grapes for all the Packers fans out there. I didn't know if that was the regular part of their. Who dat, baby? Who dat?
Hopefully the week will go fast. Okay. Maybe we'll play Western Carolina this weekend. I hope so.
Boomer Sooner.
That's right. All right. Thanks, everyone, for joining us. We'll see you back next week, 7 o'clock. Dr. Armitage, Dr. Chansom, Dr. Bookman, Laryssa, thanks. Phil Maytubby, and we'll see you next week. Goodbye, everyone.